Hi everyone, I am Dr. Krishna Reddy, consultant endocrinologist, Medical Hospitals, Madhapur. So what are the major complications of the type 2 diabetes? So the major complications in the long-standing diabetes because of the hyperglycemia. So they won't be feeling any symptoms initially, but the organ damage due to this hyperglycemia is very slow and gradual. So eventually every year the damage will be accumulated. So once the organ is damaged around 90%, you will be seeing the signs and symptoms of complications. The major risks are the cardiovascular risk. So major mortality in type 2 diabetes comes from these heart diseases. So almost 3/4 of the patients of type 2 diabetes, the mortality will comes from the cardiovascular disease because of the atherosclerosis, which will be accelerated by the type 2 diabetes hyperglycemia. So they will be land up in the coronary artery disease and myocardial infarctions. And the second major thing is development of the retinopathy and nephropathy. So these are complications of duration of the depends on the duration of the hyperglycemia. So longer the duration of hyperglycemia, so higher the risk of developing this retinopathy. So that is development of the microvasculature changes in your eyeball retina. So this will eventually lead to bleeding and aneurysm formation, new vessel formations. So this will all lead to your diminished vision, and gradually vision loss can be seen. In case of kidney disease, almost half of the chronic kidney diseases are due to type 2 diabetic patients. So the patients requiring hemodialysis and kidney transplantation, we generally see them, the major cause is the type 2 diabetes. So this will also depends on your how properly you control your glucose, along with your weight management is important, and cholesterol management is important, hypertension management of the important. Another major complication we see in type 2 diabetic patients is the diabetic foot. So this diabetic foot is multifactorial. So because of the type 2 diabetes, there will be plaque formation or blocking of the blood vessel circulation to your lower limbs, as well as neuropathy due to damage to the nerves in the lower limbs, which will result in loss of protective sensation. So almost diabetic foots occurring in this is one of the major risk factors for your any foot ulcerations. 2/3 of the foot ulcerations are due to the diabetes, and amputation risk is also very high in case of type 2 diabetes. So because of this vascular insufficiency, because of this loss of protective sensation, that is pain sensation, lack of touch sensation in the feet, the numbness and other symptoms. So this will lead to the minor trauma. So this minor trauma, if you ignore it, it will eventually land up in the ulcer formulation. So because of the poor vasculature and because of the high pressures over that ulcer area, that may feel in the healing will be very difficult. It may get infected and rapidly progressive cellulitis can be possible. So because of that, sometimes the patient may lose their lower limbs also. So to avoid this complication, you should control your glycemia along with your good cholesterol control, as well as weight management and BP control. So these are all very much essential. And the screening for these complications is also very important. At least 6 months to 1 year, you should meet your treating for doctor, and you should screen for all the complications, and then if you prevent them, so that will decrease a lot of future admissions or complications. Thank you.